Hey everyone, my name is Lisa, so I'm going to be discussing public health versus nursing. I have a bachelor's degree in public health from UC San Diego back in 2019, and then a year later I got my degree in nursing in June 2022, so 2 to 3 years later after my bachelor's of science in public health. I'm going to be discussing why I went from public health to nursing, and I'm going to discuss which degree is better. So first off, some background. I graduated from UC San Diego in 2019, got my degree in public health, and for a year I was unemployed. My first job out of UC San Diego was a year, and a couple months later I got my first job a year later, and back in like October 2020, so 1 year and possibly like 4 months later I got my first job in like a billing job, and it was like minimum wage. But I already had in the back of my head that maybe nursing will be my career of choice, just because I know it is opportunities to get a job in nursing. Outlook, job prospects, there's a lot of hospitals, potential all over the world to get experience, and then to like travel nurse. So there's a lot of opportunities with nursing. So first off, why I got a degree in UC San Diego with public health. So when I first got my degree, I didn't really know what I wanted to do. I went back and forth between engineering, maybe I'll go to like a professional school like optometry, dentistry. Realized I did not like organic chemistry. I was not smart enough to pass those classes. I immediately like changed my major from biology. I came in with a bio major like most people at UC San Diego, and then I switched it to public health because I thought maybe I'll get a career somewhere in healthcare. I wasn't sure where. I was thinking health admin, I was thinking nursing, so at least with a degree I had options. And I was thinking of transferring as well and just going straight to nursing school if I could, or just do my prereqs if I could not get a job. First and foremost, I graduated, got my degree, I struggled with a job. Did not want to be broke forever. I realized I needed a better paying job. I was living at home with my parents after graduating from university. A lot of my other friends or peers, they got jobs working as like recruiters or working for the county, or they did internships. So I think that was one of my downfalls back then, is I didn't do any internships. So if you do major in public health, get an internship, get some skills built, get some references, research. And I think a lot of people back then also was aiming to get their master's in public health, and which was, I feel like, offers more job opportunities if you are feeling like public health is what you want to do. But for me, I went to nursing school. So why I chose nursing school after UC San Diego, like I said, a lot of job opportunities, it's well paying here in California. I just wanted a job where I could take care of myself. I knew I wanted to help people. I knew I wanted to be in healthcare. I knew I wanted to do some like hands-on work. So I got into an accelerated bachelor's of nursing program, and I did my school in Las Vegas, and then I got my first job here back in California, which is nice because I wanted to stay in California versus getting my experience in Nevada and then transferring and moving back to California after. So which degree do I say is better? So I personally don't find my public health degree useful. I did not use it at all for any jobs, but this is what I kind of wish I knew before getting a public health degree, is that get internships, get experience if that is the career path you are going. Or if you're like me and you're just like, I think I want to do healthcare, but I don't think my school offers programs like nursing. I think then there's an option to either get your master's entry nursing degree in or accelerated nursing degrees. They all are the same. It's just a different degree title, and I went for my accelerated bachelor's in nursing because it was faster and I would get paid and get a job faster, which I did immediately after graduating from nursing school. And looking back, if I would go back in time, I think I would have told myself to just go straight to nursing school. That would have been an easier route. And not only that, you have options to you can even go to community college if you still have. My first degree was bachelor's in public health, and I have a lot of coworkers who got their second degree in nursing. It's because they didn't like their first degree or the career they were in, and they made the switch. So if that is you, welcome to the world. We all are doing something similar, so there's nothing wrong with switching careers. Lastly, do I regret my choices? Yes and no. Well, I can't change back time, but I am in a career where I can financially afford things, my trips, my travels, hang out with friends, purchases. I mean, I'm still paying off student loans, but am able to pay off lots of debt from school, which is nice. So if nursing is something you are considering, I highly recommend it. And there's always departments to switch in or switch out of if hospital is not for you. There's always like clinic, there's always research, there's always technology, or there's options to further your career as well in either being like an educator or a nurse practitioner or CRNA school. So there are lots of options, which is nice with nursing. So I don't have any regrets. It is challenging dealing with different personalities of doctors, of patients, and families. So thank you. And if you have any questions, just shoot me a message, or if there's anything you want to discuss, just let me know in the comments below. Bye. Thank you again.